Hi, my name's Harriet. I'm 29 years old and I'm a mental health services user in the London Borough of Haringey. I also set up and run a mental health network for staff at the Financial Ombudsman Service, and I'm a trustee for a suicide prevention charity called CLASP. Mental health is now higher on the agenda politically, in the media and in our day-to-day awareness than it ever has been, in a positive light largely, in my living memory. But I think there are still challenges that we face. This improvement in awareness and in breaking down the stigma is in no small part down to the work of the Time to Change campaign, an initiative between Mind and Rethink mental illness charities. And it's done some fantastic work in helping people feel that they can talk about what they're going through, whether they are directly affected by a mental health condition or whether they know or care for somebody who is. Now, while that work has been fantastic and it's been really important, I think there's still a lot more that we can do. There's now protection in law for people who suffer from mental health conditions and for people for whom that becomes so severe that it's considered a disability and that it affects their everyday life. Employers have to do a lot more to make sure that people are supported, but I think this is not just about top-down activity. It's all very well and good people saying what has to be done and measures that should be in place, but one of the strongest things that I've seen in my lived experience of having a mental health condition and providing support for other people that do, it's really about peer-led support. It's about working from the ground up so that people who live with these conditions and who are affected by them, well, however big or however small they consider them to be, can actually have their voices heard and talk about what they need and what will help them. And also to be a sounding board and a consultation platform for the people in the systems that are trying to make things better. So really, who better to ask than the people that are affected by a new policy, by something being implemented, than the people who it's going to directly affect. What I've realised as well in my experience in this field is that changes don't always need to be expensive and they don't always need to be costly or difficult or hard to implement. I think sometimes for employers, sometimes for local authorities, sometimes for businesses, there can be a real fear that having to put things in place to make things good and supported for people that have mental health conditions will be something that's going to be a really big challenge for them. How do they do it? How do they measure its success? Well, what I've found is actually it can be really simple. Sometimes it's just about providing a space where people who have lived experience can get together and can just talk, just to be honest and open and to not be judged about what they're going through. It can be as simple as getting a meeting room and a packet of biscuits, or saying that people can have the time to go and make a phone call, whoever that's to, whether it's to one of the fantastic services provided by people like Calm or Sane, who provide free helplines, or whether it's to the Samaritans, or whether it's just to call a friend, or just to get together with their colleagues and go for a walk for 20 minutes at lunchtime. These things are really small, but they do the important things that benefit mental health. They make connections, they give people time, they get people active. Those are the things that I think we actually need to get back to the very core of what it means to be a human being, whether you have a mental health condition or not.